I want you to see this very carefully, this particular picture, and then compare it with this picture. Do you find a difference? Well, definitely the background is different. So this is called a negative polarity, wherein the background is dark and the image is bright. Whereas here, this is called a positive polarity, where the background is bright and the image is darker. So black on white, white on black. And also just see the font. So the font is closely placed. It is difficult to read. Here the font is adequately spaced. It's easier to read. The contrast is better in this. The colors are more brighter, and the intensity of the colors is also better. So this is easier on the eyes to read something like this, right? So that brings us to how we can use our devices. We're using them every day for all our waking hours, right? So how do we use our devices and not suffer them? And looking at how we take a look at the digital hygiene. What do we do to make our lives better despite us being gheraud by all the digital devices? So if this is something that you associate with, are you doing this? I think we all are. Like when the lights are off also, we are looking at our screens, and there is a glare from the screens. And of course, we are doing a lot of work in our offices also related to screens. So what is digital eye strain? It is a prolonged use of digital electronic devices. Now, why do we say digital devices? Why not a paper or a book? Because a paper or a book has got a continuous print which is even, whereas the digital devices are pixelated. They are based on joint pixels which are based in that shape. Every pixel has a sharper area in the center and a peripheral which is blur. So the blurred area causes a greater stress on the focusing mechanism. So look at this. This is a recent conference in ophthalmology. Can you see the pixels? Can you see it again? Look at the pixels. Okay. So whereas this is another one where this was projected. This is not a pixelated screen. It was a plain kapda wala screen where the projection was done. So this seems to be better on the eyes. Yeah. So this also causes convergence fatigue. So not just strain due to the pixels, but also due to convergence. Now, this is our own conference. Look at the pixels. You can see the squares. I'm not very sure if you can make out, but in this one you can make out. This was my talk on the first day. You can see the pixels on the screen. It's our own conference, and we are looking at it since 3 days. We are looking at these very screens, right? So it is not only the digital use of digital devices, but that causing visual and ocular symptoms, and together the entire symptom complex is called as digital eye strain. But because it's a symptom complex, should it not be called digital eye spectrum? Or better still, I would suppose it should be called as digital eye syndrome. Now, why am I saying this? I'm not over-exaggerating. This is where these patients can go. They can go to the cornea specialist because of dry eye. They can go to the squint specialist because it induces your latent to manifest tropias. They can go to optometrist because, again, they manifest the smaller refractive errors, and neurologists because headache, eye strain, irritability, even sleep issues. So they can go to the neurologist or the neuro-ophthalmologist also. So it should actually be called a syndrome. Just look at the range of symptoms that can come. Yeah, so the symptoms I would like to divide into 3 groups. This is not some known classification, but it's easier to remember this way. Whether some optical or visual symptoms. These can be related to the focusing issues or the accommodative issues related to the phoreas. And of course, the second set is, of course, dry eye digital devices called dryness, irritation, burning. So all these ocular surface related, those coming to the cornea and surface disease specialist. And of course, related to the habit, how we are sitting, how often or what extent or duration we are looking at the screen. So this is leading to asthenopia, plus of course the extraocular symptoms, including the postural and sleep issues. So there's a lot of it related to convergence. It may show up as problems with convergence, with accommodation and phoreas. In children, it may lead to ESOs, whereas otherwise it may lead to EXO. So again, the association with pre-existing low levels of astigmatism, hypermetropia, and presbyopia, which can lead to an increased strain kind of asthenopic symptoms. So we already saw these, that the screen brightness is important, the contrast is important. We saw in the first two slides the glare. What is the refresh rate? So in the earlier times when we had televisions which were not so good, the refresh rates were poor. So the critical fusion frequency, we need to see so many screens or shots per minute to be able to fuse them in our brain, to see them as a continuous image. We know we don't see a continuous image, but a series of images which our brain links together and makes it into a fused image, a fused video, or this thing. So this is the normal critical fusion frequency. If the flicker is too much, then again eye strain is caused. In fact, this is known to be epileptogenic also. If the flicker is too much, it can lead to epilepsy in those people who are prone to it. So this is again, I was telling you about the polarity. Here, this is a positive polarity, negative polarity, and also there's pixelation. So also, we tend to look straight when we are looking at a screen, whereas when we are looking at a book, we tend to look down. So again, the exposed area of the palpable aperture is less. So the drying is less. And of course, there are innovations with respect to the screen factors also, like better resolution screens, matte finish screens, smoothing of the graphics. Look at this now. Now we are coming to the environmental factors. These were screen factors. Just look at which is clearer, which is better, right? There's no two ways about it. Look at this. This is in a dark environment. The ambient light is dark, but the screen is bright. There, the ambient is bright and the screen is very dark. So both cause eye strain, both cause digital eye strain. So here, just look at the glare. From behind, we'll be extended. We have only two talks here. So from behind, there's a glare coming in. And so we have to place our devices in a place where the light doesn't fall directly on the screen, and that is important. So the ideal is not even falling directly in front of your eyes, because then that will blind your eyes, not falling directly from behind because that will cause the glare. So it's oblique and preferably posterolateral is the ideal. So this is again an example of glare. And then we come to the ocular surface related symptoms. We all know about these dryness, burning, grittiness. All of us have patients where there's excessive screen use and they come with dry eye. And this is due to the tear film desiccation. Now, what is the mechanism in this? Well, you're continuously looking at something very carefully, you forget to blink. And the blink frequency should be around once in every 5 seconds, roughly. So 12 to 14 times a minute. But when we forget to blink, when we're looking at something very carefully, we forget to blink and there's a desiccation. The desiccation also depends on how much of the palpable aperture is exposed. And also, if you're looking up, there'll be more palpable. If you're looking straight, it will be medium. And if you're looking down, the least amount of palpable aperture will be prone to drying. So because of that, even the blink is affected. A blink is much easier, faster, and more frequent when you're looking down and more complete. Whereas when you're looking up, if you blink also, sometimes they're incomplete blinks. So this is very significant. So again, normal blink rate and incomplete blinks and increased exposure. These are all mechanisms in drying. Of course, the AC. Also, when we're looking down, when we're reading, whereas looking slightly up and an exposed palpable aperture, this is how the tear film replenishes itself, the blink reflex. And of course, these are the factors which pre-existing factors where the patient is anyway more prone to dryness, they will get aggravated in these conditions, right from endocrine factors to genetic factors, stress, contact lens use, they're anyway more prone. So what is the treatment then? Does it mean we should throw out our computers and digital devices? No, we are not going to go as far as that. We cannot any longer go as far as that. So what do we do? So we just need to have a multi-directional approach. It's no longer just related to the eyes, but it's a habit kind of thing. So yes, workstation adjustment, user habits, ergo ophthalmological approach. Ocular surface therapy for the dryness, optics and refractive for those symptoms. So your posture is important. If you're sitting too far or you're not sitting in a right angle versus too low or looking too down or too up. These, and look at the computer screen, the angles of the computer screen is not right. So we're coming to that. So this is something ideal. The American Optometry Association wants you to sit at 90 degrees at all joints. We are coming to that. We have a small video on that. And of course, we all know the 20-20-20 rule, but we don't know some other rules. We are just going to cover that. And the lighting should be more diffuse, more natural. So nowadays, there are some new bulbs available. These actually have been introduced. You can get them on Amazon just to grow plants. They simulate natural light, and so they can help grow plants inside your house in your closed door settings. But maybe we should do some studies and see whether they help out with our strain symptoms also. Yeah, and of course, blue light. How many of us know that the optometrist or the spectacle shops will all say, blue cut filter डालना है, blue blocking filter डालना है, मैम डाल दे, मेरे को ही नहीं छोड़ा उन्होंने, मैम डाल दे आपका blue. So then we need to understand, why do we need a blue blocking filter? So that is, of course, everything is related to the melatonin, because when the pineal gland is stimulated with blue light, it gets the indicator that it has to be awake. So blue light hampers melatonin secretion, and hence sleep is really affected. So 1 hour before sleeping, if you are using the digital device, try not to use it first of all. Let's go back to our days of Nana, Nani, Dada, Dadi stories, like with our kids also, rather than showing them a screen. Maybe the last 1 hour can be used in speaking to them, talking to them, stories, etc., rather than seeing the screen, because it's not good for us. It's not good for our sleep cycle, and it's going to definitely affect our melatonin levels. So also, how far should it be? The 1 foot, 2 feet, and 10 feet rule for the respective digital devices. And of course, the angle, it should be downwards, not straight or up. And this is how it works. Blink every 5 seconds, 20 minutes, every 20 minutes follow the 20-20-20 rule. And every 1 hour, you have to just get up and move for your posture. So lubricating drops, humidifiers are nowadays available, spectacles for uncorrected errors and for phorias. And of course, display settings we have to change, because in my office also, if I'm not comfortable with a very bright screen, then I switch off one of my tube light or one of my lights. Or if I want a brighter screen, I'll put them both on. I try to match the ambient lighting with the this thing, and I try to get the table in the right ergonomic position, as well as in position with respect to the lighting. So these are some USB humidifiers that are available. Anyway, if you're using the screen, you attach to the screen only. Okay, so of course, diet is important, exercise, lifestyle, sleep, good sleep. We cannot stress it even more, and stress management and workplace settings, as I said. I just want you to see this very locally made at our institute, with all my staff and students made this video. Please see it.
Screen hygiene is the true genie, the soul of screen use. Be it online shopping, official work, or even entertainment, increased screen time gives rise to redness, itchiness, dryness, eye strain, focusing issues, headaches, as well as irritability, all under the ambit of digital eye strain. To protect your eyes, follow certain rules in your lifestyles. Distance, for example, mobiles at 1 foot, laptops at 2, televisions at 10. Angles, a backward tilt of the screen by 20 degrees, looking downward from your eye level by 20 degrees. All lower limb joints at 90 degrees each. Time rules expect you to blink once in every 5 seconds, to look at a distance of at least 20 feet for 20 seconds every 20 minutes, or simply close your eyes, and every 1 hour just get up and move. The brightness should be neither too bright nor too dim. The light should come from behind you. At night, switch on your night modes. Do not use your screens for at least 1 hour before sleeping, else your pineal gland will not let you sleep the next day. Remember, your eyes are going to thank you for following these rules.
Yeah, so this was at reel form, 75 seconds, and this is something that I used to take 20 minutes to explain, but in video form, it's just made it to 75. So yeah, this talk would be incomplete if we don't cover what it does to us kids, you know. So not just the eyes, but there are language delays. children are talking less, there's more of autism, and this is all due to screen time. In our institute, we are a multi-specialty institute, 42 specialities. The three departments that are the most worried about screen time is ophthalmology, pediatrics, and psychiatry. They have already classified it as a addiction. It's already under addictions. So when they had the de-addiction OPD, I actually asked them, "Ki, will you do a de-addiction for screen time?" They said, yes, we will. It's already classified. So there we go. And then life skills. So impediments with life skills, definitely talking, social skills, all that is affected. Diabetes, because they're sitting in one place. Psychosocial skills I already mentioned. So we need a green time for our kids. We know that they need to look more at a distance. The myopia is increasing predominantly due to the near work, not especially due to screen time, but there's a lot of screen time associated sitting in one place and all the habit related issues. So again, we come back to the slide where we are involved. So what do we have to do now? We have to first correct ourselves, then of course our immediate community, our family, and we have to spread this message among pediatricians, how what they need to tell the kids when they are visiting them, because not all kids will come to us first. And I have had this presentation even for Indian Association of Pediatrics, and they have appreciated it. They need to be aware. Most of them didn't know most of these things. We still know a lot of these things. So community awareness programs, videos and awareness, like we did this video. And finally, we need to ask ourselves, are we relying too much on the screen? So this is something my students ask me when I tell them this talk. They said, ma'am, ye bhi to aap screen pe hi de rahe ho, ye talk. So what do we do? So does this mean that we have to go back to the era of blackboards, or do we have to some jump forward and become robotics or something, AI? Maybe not either of them. We stick to our digital devices, but do it with a balance. Thank you. Um, So I'll invite any questions if you all have, because this is something we are all dealing with directly also. I too have dry eye symptoms, and I remind myself of these rules. So if there are any questions, and because I'll just check if we have our other speakers. Manisha Rathi, do we have? Okay. Monica Dahiya? No. And Dr. Raj Lakshmi, you're here? Okay. So we can have yours after this. If anyone has questions, you can upload your presentation, if whatever. So if we have any questions, we are opening this. Yeah. Yeah. Can she have the mic, please? Excuse me. Mic. Yeah, it's here. Yeah. Yeah. So that's what we said. The community is important.
Hello. Most of the children complain that their parents are on screen. It's like so obvious when you talk to them
So
in
that's why we
OPD.
start with ourselves first.
Yeah, I think the parents need to be educated more, like how they behave. The
So
children.
schools, of course, we
Yeah.
can go to schools. A lot of schools take pride in showing them screens and taking classes. And many of our parents actually say that, oh, he's going to a smart school, my kid. So is it so smart after all? I'm not very sure.
Yeah, the habit of reading books is also reducing, subsequently because of all this.
But
Children.
especially now, we need to look at playing outdoors and looking at distances. So playing in the green, because again, books definitely it's something that they need to read, because the strain factor won't be there. But of course, near factor is still there. So anyone else wants to comment, madam? If you want to comment anything, okay.
Same.
Should we proceed to the next one then? Yeah.
Actually, in
Ma'am,
our
please.
place also, we are trying to go for schools and address them regarding this digital eye strain. And recently, we had a talk to the residential school. So, as you say, they are engaging themselves and they are taking pride in telling that they are switching over to the PDF forms and Kindles and all these things. And as you say, most of them are not aware about the postural difficulties, the orthopedic problems that can arise later on because of the digital eye strain as well.
So, the most recent addition to the concerned group is the orthopedician. They actually have these humps. The children have these humps.
Yes.
So they had pointed it out to us on our faculty group, the WhatsApp groups and all. And very much so, what the mind knows, the eye starts seeing, right? So when I was traveling in one of the airports, one kid was nicely very affluent family. He already had a 3-year-old kid already had that hump because he's continuously looking down. His orthopedic, the posture is changed. So it's very concerning. Yeah.